Developing at this hour, big news from Pfizer, reporting its antiviral pill to treat coronavirus is showing in trials to reduce the risk of hospitalization and death by 89% if patients begin taking it within 3 days of first symptoms. The CDC director calling it another great tool in our toolbox this morning. Dr. Anthony Fauci welcomed it as good news as well. Pfizer is seeking emergency use authorization for this pill as we speak. For more on this, joining me right now is Pfizer's CEO, Albert Bourla. Thanks for being here. Really appreciate it. So with this news, how does this change, in your view, the course of this pandemic?
I think it's a game changer because right now, one of the biggest problems that we are facing, it is that when we have peaks of this disease, when we have the waves that are coming, the hospitals are really overcrowded. And that creates significant issues to the healthcare system. Right, with this pill, we are expecting that instead of 10 people going to hospital, only one will go, and actually no one is dying. So these are very, very good news.
And if people see this news and think, I don't need to get vaccinated or boosted anymore, I can just take this pill, what do you say to that?
I'm afraid that there will be some people that will think like that. It's a very big mistake. Vaccines are needed. Vaccines is the primary frontier that we should be using to stop the disease. The goal is not to get sick and then hopefully have a medicine that can save you. The goal is not to get sick. And not only you not to get sick, but to prevent sickness from your kids, prevent that you get sick and then you transfer that to your mothers, to your fathers, to your parents. It's very important that people will take the vaccines. And for those that are unfortunate, that despite that, or because they didn't take the vaccines, they are sick, of course, now we have something that will save a lot of lives.
You mentioned children. Can kids take this antiviral pill?
The pill is been studied in more adults. I hope that we can get it also in adolescents, but that's something that is FDA to give the permission for, and we will wait to see.
Do you know how long it will be until you would be confident, yes or no, on that?
I think we should wait to see what FDA says. FDA will take their time, but they have a very high sense of urgency, and given the severe public health need, I think they will act very quickly, maybe this month.
Assuming FDA approval, let's just assume that for the sake of this conversation, when do you think there will be enough of this available so that every American will have access to this treatment when it is the most effective within 3 days of first symptoms?
Assuming FDA approves it, and by the way, it is not effective only on the 3 days. On the 3 days was 89%. When the people got it 5 days, was 88%. So we have a very strong efficacy even if they take it a little bit later. Clearly, they should take it as soon as possible. Now, assuming that there will be an approval from the FDA, we will be having quantities of this medicine available immediately. Now, the quantities will be in the tens of thousands immediately. In January, we'll go to hundreds of thousands, and then February, March, we go to millions. Treatments, so not pills, treatments.
Treatments, exactly. So I was going to ask for that clarification. And treatments being the entire course that you would need in order to follow this treatment.
The entire course that you need for 5 days, day and night, all of that makes a full course of treatment. Tens of thousands for this months, hopefully up to tens of thousands, and then hundreds of thousands in January, immediately, and millions will go in February, March.
So while that happens, let me also ask you about booster shots and the vaccine in general, and also the Omicron variant. This new South African study showing that the Pfizer shot's only 33% effective against the Omicron variant, but also that people infected with Omicron are less likely to end up in the hospital. Does that mean you will or won't need to roll out an Omicron-specific vaccine, do you think?
We are still waiting to see more data to understand if there will be a necessity to do that. Actually, the studies in South Africa that we reported, if I'm not mistaken, they are only for 2 doses. The third dose, and to have studies not necessarily from South Africa, but to other places that they are way more advanced with a booster, is really it's way stronger, the protection. So we are seeing already on the 70s, 75% protection in the initial data that we are getting. I don't know if we will need an Omicron vaccine, but what I know is that we cannot take chances with that. So we are moving full speed in developing one. And I know from the studies that we have done so far that if we need to make one, that one will be very effective against Omicron, and that likely will be ready in March, and that will be ready to manufacture it at very big quantities. So from that, we will be covered. If we don't need to have it, we will put it on the shelves. But if we need, we will be there.
And so when Dr. Fauci, he was on with me last week, and he said that in his personal view, it's a matter of when, not if. The definition of fully vaccinated is going to change from 2 doses to be 3 doses. Do you think fully vaccinated means 3 doses already?
I think so. I think so. And everybody in reality thinks, I think time has come to make an official stamp on that.
This is, it can't be forgotten that this is the 1-year anniversary of the first person being vaccinated with the Pfizer vaccine. A truly amazing moment, but still also coming in the coming days, we are going to hit 800,000 deaths in the United States from this horrible disease. How do you reflect on all of that? You know,
first of all, what catastrophe, I would say, for humanity and the country that this pandemic was. And how blessed we were to come quicker than anybody thought, us and others, with very effective treatments and very effective preventions. Particularly for our company, you know, in the anniversary of the first day that we administered in an American this vaccine, and that was the first vaccine administered against COVID, to come now with a treatment of 90% effectiveness, you know, personally makes me very proud about the scientists that we have and the people at Pfizer that were able to make that happen.
Albert Bourla, thank you for your time. Really appreciate it.
I thank you very much.